Dr. Vimal, a very warm welcome to you. So, Dr. Vimal is an ENT and head and neck surgeon. He did his MBBS from PSMC Karamazad, PG, and PSMC Jamnagar. Worked for 3 years as clinical assistant at Bombay Hospital, Mumbai. He also did his he's also doing his private practice since 2003. He has special interest in head and neck surgery and implant surgery. He has presented papers in national and international conferences. He has also worked in the field of awareness about tobacco addiction since 20 years. He's a passionate amateur wildlife photographer. I would like to know at what part of the time in your career did you made a call for this, for choosing MBBS as your career option?
Um, Actually, my father's a doctor, and I've always seen him working. So mainly, I always wanted to be a doctor because my father was a doctor, not just because of my father, but I also saw him working for humanity. And staying with him, I also saw him absolutely satisfied with his work and all. So work satisfaction was number one. Number two was humanity. And this is one of the professions where whatever you do, you hardly ever cheat any patients. So that's how it was really interesting for me to become a MBBS, and I mean to enter into medicine line. So that's about it.
So, sir, definitely, we have seen that children of doctors usually wants to become doctor, and definitely to serve patients is a very interesting, choice. So, I would like to know that at what point of time did you, uh, you know, got to know that you want to do you want to specialize in this particular field, like you want to specialize as an ENT.
As I said, my father's a doctor, so he's basically a general surgeon. So that actually was fascinating because operating patients and giving results, like they're so happy after the surgery and all. So that's when like in final MBBS, after studying a lot of subjects, I was leaning towards surgical side from beginning, but after learning a lot of different subjects, I realized that surgery is my thing, and probably I'll be able to do much better if I'm a surgeon. So my choice was to go for general surgery, like my father was. But then soon I realized that if I go for surgery, by the time I was in internship, I realized that there are a lot of other super specialties which I have to do if I have to survive in general surgical field. So rather than going for general surgery, I decided to go for ENT because ENT as such is a surgical branch, but it's an end branch. So uh, there were no super specialization in that branch at that point of time, and limited area to work. I mean, just head and neck, but again, it was very challenging. Like it also has a microscope to work with, and it also has different surgical instruments to work with. So that's when I chose ENT.
Okay. So, I would like to know that if we talk about your 24 hours of the day, what is your daily routine, your roles and responsibilities as a specialist, and definitely how do you start your day and how do you end up your day? So, if you can tell us a gist about that as well.
Everyone has their own different routine, but I always like to be very busy in my schedule. So I usually start my day at about 5 o'clock, and my surgery starts at 6 o'clock in my private clinic. By usually 9 o'clock, I'm free, so I start my OPDs at 9 o'clock till about 12:31, and then after a quick lunch or quick bite, I go to different hospitals for surgery. So I'm attached with 5 or 6 big hospitals, corporate hospitals, and charitable hospitals where I go for surgeries and all. So afternoons are for surgeries again, and I usually come back by about 5 o'clock. So from 5 to 7:30, I again am busy with my OPDs. At about 7:30, I go home, have dinner, freshen up again, and then I do other works like if I have shot some good pictures, I might edit them or read something because I like reading a lot. So that's my usual day. Uh, yeah. So
Okay, so some, like every patient is definitely a good experience or a bad experience. So can you share one of your most memorable, maybe in, very challenging or a very memorable experience, any patient case you managed during your journey till now?
pointing out at one particular case is very difficult to choose because it's been like about 20 years I'm into private practice. So, is it okay if I say a few cases rather than just one case?
Sure, sure, sir, no problem.
Yeah. So, starting from ear, like our branch is ENT, ear, nose, and throat. So, one patient actually came to my OPD, a young, small kid, about 6, 7 years. The mother complained that the boy is having a lot of pain and constantly complains that something is moving in the ear. And when I saw him, I realized that patient had actually maggots in the ears. Maggots is in a uh, small insect, and there were lots and lots of them. So maggots are usually like when a fly puts eggs in the place, it grows like maggots, and then it finally grows into fly. So that was maggots in the ear. I had to take him under general anesthesia and take out all those maggots and all, cleaned it up, and also that was something which I didn't expect in a small kid like that. One kid I remember is about 12, 13 years old girl when I was in Bombay hospital. She was referred to us by an ophthalmologist. So this girl actually suddenly got blind. So obviously they go to an ophthalmologist. The ophthalmologist, that eye doctor, actually saw her, asked her to get MRI, these and that, and all investigations. And on about third day, they sent the patient to us, and we realized that a sphenoid sinus, like that's a sinus in the base of the skull. Sphenoid sinus has a weak cyst into the sinus, and that is what was pressing the nerves of the eyes, ophthalmic nerves, and that's how she became blind. Optic nerves, and that's how she became blind. We actually just had to open up the sinus, remove all the pus, and things would be okay. But unfortunately, if someone gets blindness, sudden blindness, one has to like treat it in about 8, 10 hours. And this actually girl came to us in after 3 days, so we couldn't save her vision. But that was like a very simple procedure, got a bad consequences. Uh, foreign body in neck is also a very different thing and a challenging thing. As in, one patient came to us saying like, he was a factory worker. So he said that sir, a metal piece went into his neck here, and I saw there was no bleeding. There was just a small scar from where this metal piece went inside. So I was like tempted to, chalo, I'll just remove it from in the OPD itself and let the patient go. But my sixth sense actually stopped me from doing it. So I asked the patient to go for sonography. And soon I realized that the foreign body, the metal piece was actually stuck in the vein of the neck, which is getting blood from brain to the heart. So if I did that venture in the OPD without thinking, I would have ended up losing the patient. So that's one of the challenging cases I remember. And lastly, as you mentioned in my introduction, I work for anti-tobacco campaigns and all. Um, One of the girls of 9 years old came to us, and she had a habit of having chewing tobacco. And she actually had cancer of tongue at that particular age, at 9 years. That was a challenging case to treat, as well as it was challenging to even talk to relatives and parents and also. So these are the few cases I actually remember.
Definitely, sir. Hearing these cases, some were really challenging, and you must have experienced a lot with these cases. And I definitely, though these are some of the cases, and you must have experienced many of these such kind.
Oh yes, yes, plenty of them.
Yeah. So, my next question, is how is your work-life balance in your specialty? Like, how do you manage your own time, your time for the family, and your weekends with the work?
Well, it's really easy. As in, you have to prioritize your life. So apart from, as I said, as I already told my schedule, I usually make it a point to stay with the family in the evenings for at least 2 to 3 hours with them. Um, Plus, to get my sanity, I have a very good hobby of photography. So that is it. Then I take small breaks from work, go out with family for 2 3 days every 2 3 months. So rather than spending one particular vacation for 15 days, I prefer taking small breaks and probably one bigger one. That helps me balancing my life with other things. As I said again, reading is my hobby, so I read a lot. I also like to watch movies. Yeah, I keep doing these things, and Sundays are strictly for the families. So I don't work on Sundays uh, unless, of course, there's an emergency, which I now at this age uh, I don't intend to go for work on Sundays. So that's how my uh, life is balanced.
Okay. Sir, basically, I would like to know that the case you shared, there's one of the student asking that did she got her eyesight back then?
No, unfortunately not, because she came after 3 days of blindness. So it was too late for anyone to get her vision back. Unfortunately, yeah, she didn't get the vision back. She had to remain blind forever.
Okay. So, these students are just appearing for their MBBS, and definitely they'll take 5 years to complete their graduation. So, what do you think? Like after 5 or 10 years, how are your specialty prospects in India or in terms of abroad?
ENT per se is a very important branch. Plus, more than important, it emerges like anything. So we have taken over a lot of other specialty surgeries as well, and it's not just limited to removing wax from the ear or treating tonsils or straightening the nose or nasal septum. So ENT definitely has a very good prospects in India as well as in different part of worlds. But of course, if you go abroad, probably you'll have to appear for their licensing exams and study there for a few years, and then you can start practicing out there. But ENT definitely is a very challenging branch, and it's a emerging branch, and it's really good to go for it.
Okay, definitely, like I would like to know that there's one question from my side. Like, what would you say? How was the intense of your specialty need after the post-COVID era?
COVID actually was a disease of upper respiratory tract and the lower respiratory tract. So definitely that comes, and you know that all the RT-PCR and antigen tests were done from nose only and the throat.
Yeah, yeah, exactly.
Apart from that, now that the COVID is little less, upper respiratory tract infection is very rampant, and that also comes under ENT. So, plus, if you remember or if you know word mucormycosis, if you've heard of, now mucormycosis is a fungal infection happening in the sinuses. That also came up in a big way in Gujarat, especially, and different parts of India as well. But we had lots and lots of cases of mucormycosis after COVID, so that also was a challenge of ENT surgery.
Okay, so definitely, thank you so much, sir. And the next question I have is like there are many researches happening around the world, and what are the new fields or research happening in your specialty?
Well, when I entered ENT, I realized that I thinking that ENT is an end branch. कि एक बार ENT हो गया, I'm fine with it, and then I don't have to study anything further. But soon after entering ENT, I realized that it has lots and lots of other sub branches. Like otology is someone specializing only in ears, and then otoneurology and equilibrium is in giddiness and ear ringing and um, ear problems related with the brain. And then the new thing came up is cochlear implants, which is helping deaf and mute children to start listening, hearing, and speaking. So that also is a new research which is going on. Then in nose, if we count rhinology per se is nose surgeries plus rhinoplasty, the plastic surgeries of nose as a separate specialty. Allergy is a specialty. Endoscopic sinus surgeries is another specialty. And then even further to that, endoscopic skull-base surgery is also something which is coming up. In throat, if you see larynx, laryngology, microlaryngeal surgery, voice and speech specialty, and then head and neck, as in benign and malignant tumors of the head and neck and ear, nose, and throat. Then reconstructive surgeries. There are a lot of plastic surgeries which is happening around, and of course the robotic surgery. So apart from stem cell and different surgical research fields, these are the fields. In every of these fields which I mentioned are emerging day by day, and the new researches are going on in those things.
Okay. So thank you so much, sir. So, like, what do you think? Why should young doctors pick up your specialty?
Because it's good, I would say. But apart from being good, it's an emerging branch. It's a challenging branch. So if you are accepting challenges, probably ENT is your thing, and it is really helping people, like as simple as ear wax. So just cleaning earwax and let people hear, or just remove tonsil and let people eat ice creams, and all those things are also like very satisfactory. So um, ENT is a branch where plus it's a mix between the major surgical branches and minor surgical branches like ophthalmology. So where in ophthalmology they're just working with eye, but in ENT you have nose, ears, throat, and that goes on till bronchus and esophagus. So that's how it is. Something which would interest you and would definitely help you come up.
Okay. So, sir, my next question would be like these students would be studying their MBBS right now. So, what do you think, like those who are really willing to opt for ENT, what should be the important subjects in the whole MBBS curriculum to become specialist in your field?
Um, Frankly speaking, all the subjects are really, really important, but I never used to like biochemistry. But apart from that, yes, anatomy is absolutely important for any surgeon. So anatomy, which comes as a subject in the first year, and then physiology. If you know how your body works, probably that would help you treat your patients properly. In second years, you'll get pharmacology, wherein you'll learn more about medicines and compounds and drugs and all those things. Microbiology, wherein you'll learn viruses, bacteria, parasites, and what all infects and how all infects and what can you do about it. So second year is like that, and third year, of course, you'll have to learn on medical part, surgical part, and everything. So to me, everything is really, really important in any field you go ahead of after MBBS. So, but yes, any surgical field, anatomy is the important subject one has to know in and out. And plus, head and neck anatomy is really complex, and nobody gives a lot of attention in first year because it's complex and because it's kind of boring, because you hardly ever see things like other parts of the body. So that is what is challenging. So anatomy is 100% worth. Plus, as I said, every subject is really important. Ji, Pooja ji.
Yeah, so I totally agree that every subject is really important for each and every student, whether they choose any of the specialization. So I guess, sir, this would be, correlated to another subject as well, if you choose any other specialization as well, right?
Absolutely, yes.
So students have the tip, do focus on each and every subject you have on in your MBBS curriculum. Okay, so sir, my very last question, not a question, just a tip, you can say. Like, what would be your message for the aspiring physician?
Well, I would say medical profession is really noble, and one has to be kind enough to treat your patients. So having said that, it doesn't mean that you don't take charges. You take money, but you give your utmost care and compassion, and use your brains to treat the patients. ENT per se is a branch wherein you can choose your working hours. So if you want to work less, you can reduce your work hours. Plus, for ENT, as I would like to say, is that it's the branch wherein you can choose to be aggressive and choose emergency part of it, and even you can just do cold work like office works and the small surgeries and all those things. Since ENT has taken over a lot of surgeries from different specialities, so that also is something really uh, inspiring to go for ENT and become good people. Plus, ENT is something like you can settle down in village, you can settle down in a town, you can settle down in a city or a metro. So basic ENT to the super duper specialties you can do, and you can work according to the place where you're working. But aspiring doctors, I would say that you have to work hard, and since you've opt to go for medicine, always remember that you'll have to study always. You cannot stop learning, because that's the end of progress. So you'll have to study always, you'll have to work hard, you should work hard rather, and of course earn money and good fame. But at the same time, always remember that you have to be compassionate, and you have to be humane. So that's my message for you all.
One of my question would be, how what do you think how much popular the choice of ENT as a specialization is in India?
ENT is a popular branch. As such, people are not choosing it as a first choice, because people are more attracted towards dermatology, as in skin specialty, radiology, medicine, orthopedic, and all those things. But since ENT has a lot of other things and a lot of things to offer, I think it will come up in next 10 years like anything.
Okay, so what do you think, like, if we have a question from a student, so if I choose ENT for USMLE, so what do you think, like, will the plan would be perfect, or should I do only in India?
I didn't get the question, as in you have to do ENT and then go to US, or you have to do ENT out there?
If I want to do ENT from US and settle up there, is that a profit, or should come back to India? Is that a profit?
Uh, if you are considering profitable thing, definitely learn ENT from abroad and settle down there only, and especially US. But if you want to come to India again, you'll have to appear for the exams and everything. So I would rather say, if you want to settle down in India, probably do an ENT surgery here. Go and learn your specialty and your way up abroad, maybe in US or somewhere, and then come back again to settle down and develop your specialty. So that would be my suggestion for you.
Okay, thank you so much, sir. Definitely, it was a very knowledgeable answer. So, sir, what do you think? What is better, as an MS in ENT as a surgeon, or just as a physician?
Well, ENT is just a surgery, so it's MS ENT only. It's not physician, so you can't be a ENT physician or ENT surgeon. There's only one way. It's ENT surgeon. So if that was your question, so if you're comparing just being MD physician and an ENT surgeon, probably they are different things. Yeah, I remember one case wherein a girl came to us, small girl about 5 or 6 years old, came to us for some ear problem, and we had to ask her to go for an MRI. So MRI guys say that there's some metal in the body. So they actually tried searching any metallic objects in her clothes and anything. So they actually checked everything and they couldn't find anything. So they had to request the parents to go for an X-ray. And on simple X-ray, they could find out that there was a coin which was lying in her upper esophagus, and because of that, they used to get that disturbance in the MRI. So on asking parents about it, they were not aware about it, and then parents took the girl in the confidence, and then she said that yeah, she actually was playing with a coin about 6-7 months back, and then she actually ate it, which never came out, and it was just stuck there. But the girl never knew about it, and nor even the parents knew about it. So that's how it is different, and I do remember that case. Another case I remember was, there are some when you are eating and suddenly you get a cough or suddenly you sneeze. Sometimes some food articles go into your windpipe, that is called as bronchus and trachea. So if that foreign body goes inside, one has to remove it. Otherwise, it will give infection, cough, and a lot of complications. So one particular girl was like doing something with safety pins, so she just kept it in her mouth, and suddenly she coughed, and that safety pin opened up and went into her trachea with the windpipe. So it was really difficult because if we try and remove it, the open one, it actually gives a big tear in the trachea, in the windpipe, which is fatal. So yeah, that also was kind of very challenging case for me.
What is the
Okay.
current state and future career outlook for this specific area, within this particular field?
No, it's a very as I say, it's an important thing. It's an emerging and challenging branch, and it has taken over a lot of surgeries from different specialties. Like as you probably mentioned in my introduction, that I'm an head and neck surgeon, so I do treat cancers of ear, nose, and throat. So we've snatched cancer surgeries from cancer surgeons. We do some of the eye surgeries, which is called as DCR. One surgery is called as optic decompression. So those kind of surgeries we have snatched from yeah, ophthalmologists, the eye surgeons. Sometimes we do some part of brain surgery as well, like pituitary tumors, which is done from the nose. So that part we've snatched from neurosurgeons. Um, uh, the rhinoplasty, as in straightening of the nose and all, that we've taken from plastic surgeons. And then bronchoscopy, wherein a lung specialist used to do it. So now we are doing it. So again, that is an emerging thing. Cochlear implant surgery, which is a very specialized thing. A lot of robotic surgeries which are coming up. Even the thyroid surgeries, which is done from here, from the neck. Now they are doing from different routes, laparoscopically and other things, so that the scar is not seen on the neck. So those are many new things which is like coming up in ENT, and definitely it's a very challenging and lovely branch to go for.
Know how will this specialization benefit me in my career?
Well, any specialization helps for the career. So, like in ENT, as I said, you can choose your working hours. You can be flexible. You can have high emergency lines in ENT. You can do cold work like just office practice and do simple surgeries. uh, you can settle down in village, you can settle down in town, city, even a metro city. So wherever you want to settle down, so even that is not an issue. So it's not as complicated, like, if you're a general surgeon, probably you'll have to go for different super specialities, like laparoscopy or cardiac or oncosurgery or urology or nephrology or anything like that. So that's how being an ENT surgeon, as I say, it's an end branch as well as the emerging branch. So you can opt for different specialties even after ENT, and if you're just an ENT surgeon, you can do a lot of work. So career-wise, definitely it's a wise decision. Plus, you don't have to invest so much in other things like ophthalmologists have, eye surgeons have a lot of equipments and microscopes and these and that and all. We do have different instruments, but they're not as costly, and its overall investment is not as much. So if you're considering that also after your studies, probably that also is something which you should think about.
Okay. So, sir, we have a next question from a student, and she's saying that if I get very confused in choosing my specialization, can you tell me what should I do? How do I choose a career specialization?
Well, unfortunately, these days, students are always busy reading and preparing for NEET PG. So the time when actually you go for internship, you actually learn a lot of things, and then that actually gives you an insight of which branch you go for. So if you do your internship properly, probably you'll be able to know which specialty you like. Besides that, while studying also, you'll realize that you particularly have an affinity towards a particular subject. Like if you're reading, appearing for dermatology, skin thing, or radiology, or different specialties, you realize that, okay, yeah, I like this little better than the other things. So definitely, it's a challenging thing in a way that you always have a query about if I don't go for optal, if I don't go for this and that, and what will happen. But yeah, do work hard in internship, go for clinics, go for clinical terms in your second and third MBBS also. So that's how you will probably uh, develop your interest and know exactly what you want to be after your MBBS.
Okay. So, sir, we have one more question from a student. She's asking what motivated you to choose ENT as your specialization?
Um, okay, I actually mentioned it earlier. Uh, I wanted to become a surgeon. That is what I decided from the day I entered the surgical ward rounds in second and third MBBS. So it was fascinating. It was giving a lot of good results. Plus, I have seen my father working as a surgeon. But I didn't want to go for general surgery because then, as I said, I have to go for different specialties. And ENT per se was an end branch at that particular time. So that also was my idea. But then I actually developed my interest in head and neck surgery. So I worked 3 years in Bombay Hospital as a clinical assistant in head and neck department and developed my specialty from there.
Okay, so we have one more question related to, the subject. It's like, do adults ever need their tonsils out, or is that only common in children?
It is usually common in children, but if it is giving trouble to adults, probably like the common thing is that if it gives infection for 3 to 4 times a year or maybe more than that, probably it's good to go for tonsil surgeries rather than keeping it and taking antibiotics every now and then.
Okay, so we have one more question. Does your work get stressful for you sometimes?
Yes, yes. Not just sometimes, many times it is stressful because uh, do whatever, but uh, any surgery is stressful, especially if you're going for a difficult one or something which is different or challenging. In that case, it is really, really stressful before you discharge the patient. At times, as you've heard a lot of incidences of patients, relatives misbehaving or beating doctors here and there. That also is kind of an ugly situation for any doctor, especially surgeons. So, um, fortunately, I've never faced such situation, but even thinking about it gives me a lot of stress. So, it is definitely a surgical branch per se is really, really stressful branch.
Okay, so sir, can you just explain that what do you do to relieve this stress and how do you manage all of the things, the stress and the work and the family together? In that stressful environment, does it really affect your personal life or your work life?
For stress, I love listening to music, and usually in my OPDs, I keep some music in a very, very just audible volume. You know, that gives a lot of calm in my mind. Plus, as soon as I go home, I try and forget everything what I did in the during the day. So that also is a good thing to do. And when you are with family, you be with family. You talk to the children, talk to your parents, talk to your family. Uh, uh, Watch TV with them at times, rather than watching news and reading newspapers. Read something which is interesting, which is in your likes, or maybe read books or watch movies or listen to music or do whatever you feel like. And my stress buster is my photography. So whenever I get time or whenever I feel like, I take up my camera and just push off, and when I'm with my camera, it's kind of my meditation. So that is really helping me to bust the stress.
Okay, so we have one more subjective question. Can hearing loss cause dementia?
If the question is about hearing, I would say hearing and dementia doesn't go together usually, but hearing loss do give some kind of depression because if you all know about Helen Keller, have you heard of Helen Keller? Helen Keller was a poet. She was deaf and blind since birth. So when someone asked her, because she was a famous poet, a lot of interviews were being published on the newspaper. So some journalist actually asked her that if God gives you one particular disability in your next birth, what will you choose? And now listen to the answer. She said that she would rather be blind than deaf because if she can't see, that's okay because at least she can hear what is going on and she can communicate. But if you can just see and don't listen to what is going on around, it is really depressing because when you're in a group or wherever you are, you know that somebody is talking, but you can't understand, or you can't hear, you can't even communicate. So hearing loss actually should be taken seriously. If any person has deafness, it should be treated by any means, like by if possible surgeries or to even hearing aids. That's important.